This wage differential is causing an exodus of home care staff to long-term care.
Sue Vanderbent says personal support workers are leaving home care for long-term care jobs in droves because they can make more money, meaning there are fewer people available to help keep seniors living at home.
And if COVID has taught us anything, it's that's where people need to stay.
A July 2020 Ministry of Long-Term Care report on staffing found PSWs in home care averaged $17.30 an hour, while those working in long-term care averaged between $21 and $22 an hour, about $4 to $5 more. Vanderbent says that needs to change to make it equal to keep up with demand for home care.
We need tens of thousands of people.
Ivy Bourgeot is a University of Ottawa researcher in long-term care and home care who says it's bad policy for PSW work in one sector to have a wage incentive over another.
It doesn't make a lot of sense if you're doing the similar kind of work at home and why you have a different wage by setting.
We asked the health minister if the Ford government is considering a universal wage rate for PSWs, something the president of SEIU Healthcare, a union representing PSWs, has called for.
Well, we did make changes a while ago to increase the wage rate and trying to equalize more or less the rates across the system because we didn't want to have workers moving from one system to another because there was that kind of a discrepancy in pay rates.
Last October, the government invested $461 million to temporarily raise the wages of all publicly funded PSWs to try and attract new workers. Those in long-term care and home care got a $3 an hour bump, but that's set to expire March 31st.
We'll see what happens after March 31st because we greatly value the work that they do.
Just yesterday, Ontario announced a $115 million investment to cover tuition for 6,000 prospective PSWs, but union leaders wonder why it took so long. Matt Ingram, CHCH News, Hamilton.